Hello guys, I hope you're having a great time because I am always having a great time. Just kidding. Okay, so if you haven't watched the first part, which is here, I highly recommend watching it before watching this one. So if you have watched it, let's jump into this part. Well, a quick reminder, cervical cancer is a virus-induced cancer, mainly caused by the human papillomavirus, HPV, which is the main risk factor. Therefore, primary prevention is based on vaccination against the most common types of HPV. The diagnosis of cervical cancer is based on a combination of clinical symptoms and paraclinical examinations. While symptoms vary depending on the stage of the disease, in early forms, the discovery is often accidental, either during a screening pap smear or what we call cervical uterine smear, or during a colposcopy performed for other reasons. Endometriosis or abnormal bleeding, often after sexual intercourse or spontaneously, may be a sign. Pathological leukorrhea or the presence of abnormal vaginal discharge, often associated with infections, may also be another sign. In more advanced stage, signs of invasion of surrounding structures may appear, like some urological complications like pelvic pain, hematuria or blood in the urine, renal failure or anuria, meaning the absence of urine production. Rectal bleeding and abdominal pain may also occur, related to the invasion of the rectal area. Swollen leg or massive edema, often due to metastasis or obstruction of lymphatic vessels, can also be another sign. In addition to these local signs, general signs may include unexplained weight loss, persistent fever, anemia, or other symptoms, which may be related to chronic bleeding or other causes. This cancer can sometimes be discovered during a metastatic workup. Age is a determinant factor. Cervical dysplasia, which can progress to cancer, generally occurs around the age of 30, while invasive cancer appears on the average at 45. The patient's medical and surgical history, including surgical intervention, gynecological conditions, or treatment received, helps guide the diagnosis. And the risk factors for cervical cancer mainly include HPV infection, as we said before, particularly types 16 and 18, which are responsible for most cervical cancer cases. Other risk factors include early and unprotected sexual activity, a high number of sexual partners, and smoking. States of immunosuppression, for example HIV infection, corticosteroid therapy, can increase the risk of cervical cancer due to decreased immune system efficiency. Multiparity or having had several pregnancies can also be a risk factor. Although the role of genetic factors is not fully understood, certain hereditary predispositions may increase the risk of developing this cervical cancer. Now let's jump into the clinical examination. During the speculum examination, if the cancer is microinvasive, the examination might appear normal. However, in the most cases, the tumor might appear budding, friable, or articulated that bleeds easily upon contact. The base of the tumor is usually hardened or undulated. It is also essential to look for any clinical signs of invasion in the vaginal wall. Vaginal examination aims to detect any masses in the cervix or tumors that bleed easily. It is essential to palpate the vaginal walls, including the anterior, lateral, and posterior, and the 4 vaginal furnaces to detect any possible invasion. Biodigital examination is performed to assess the recto-vaginal septum, and rectal examination is used to explore signs of invasion of the parametria or rectum. And the general examination helps evaluate the patient's overall condition and detect any systematic signs, such as any lymphadenopathy, which may indicate metastasis. When it comes to paraclinical examinations, are very essential to confirm the diagnosis and assess the extent of the cervical cancer. A biopsy is crucial for confirming the diagnosis. It allows the collection of the tissue sample for laboratory analysis. Histology determines the degree of the tumor invasion, which help assess its aggressiveness. Immunohistochemical techniques are sometimes used to differentiate cancer of endometrial origin from those arising from the endocervix, as they can present with similar clinical form. And pelvic ultrasound is performed either transvaginally or transrectally, which allows the evaluation of tumor size and local extension. It also enables the visualization of the adnexa, bladder, and rectum to detect possible metastasis or neighboring invasion. When a body lesion is observed on the cervix during speculum examination, several conditions should be considered in the differential diagnosis. These conditions can mimic cervical cancer due to the presence of similar lesions. First one, cervical polyps. This can appear as budding masses but are benign. Syphilitic chancre can cause an ulceration similar to cancerous lesions. And cervical fibroid, which is a benign tumor often mistaken for malignant tumor due to its shape and appearance. A large neighbored cyst, which is a metaplasia where the glandular epithelium is covered by squamous epithelium, creating cysts on the cervix. This condition must also be considered in the differential diagnosis. Finally, endometriosis can also present as lesions on the cervix, but they are usually localized and have a different appearance from cervical cancer. After the positive diagnosis, the FIGO clinical classification is used to determine the stage of cervical cancer. It is based on clinical examination under sedation and serves as the reference for therapeutic decision making. Cervical cancer is classified into several stages, from stage 1, where the tumor is limited to the cervix, to stage 4, where cancer has spread to other organs like the bladder or rectum. Each stage is further divided into subcategories A and B to better describe the local and regional extents of the disease. I hope these informations were helpful to you, and if you have any questions, no matter what, just leave them below. We will talk about the treatment and management of the disease in the next videos. Thank you so much, and I'll see you in the next one.